as floods continue to wreak havoc in parts of Limpopo and parts of Mpumalanga. Now, members of the South African Red Cross Society are rolling up their sleeves to help respond to the mounting humanitarian needs on the ground. For a discussion on this, I'm joined by Dimpho Teffo, who is a disaster officer with the South African Red Cross Society. Dimpho, good to have you on the program this evening, despite the circumstances. Can you give us a clear picture, really, of the current situation on the ground in Limpopo and Mpumalanga as these red level 10 weather warnings remain in place?
Thank you so much, Nhlanhla, and good evening to the viewers at home. To put it in simple terms, the disaster has reached our communities far and wide. The impact has been felt greatly. The disaster management teams from the South African Red Cross Society have been in the field jointly with the municipality authorities, and they have been conducting rapid needs assessments, as well as distributing relief in the form of blankets, mattresses, dignity packs, also offering psychosocial support, acknowledging that such an event comes with immense trauma. Our teams are also disseminating early warning messages for those in high-risk areas where the impact is still going to manifest through heavy rains and flooding. So those are currently the efforts that have been done by the South African Red Cross in Limpopo and Mpumalanga.
Yeah, as we can see in our images, your assessments are also showing extensive damage to homes, roads and bridges, particularly in the Bembe district. How is infrastructure damage affecting rescue efforts, but also access to affected communities?
Like I said, the damage has been quite significant. There are damages to critical infrastructure, such as schools and clinics. Roads are also heavily impacted, which means that relief can't reach communities as quickly as we would like it. We are also assessing some of the evacuation centers, as I think in Limpopo today, already 86 residents were moved to evacuation centers. And that just tells you how much the evacuation centers are also overwhelmed. So in that regard, critical infrastructure, other than households themselves, have been severely impacted.
Yeah, we understand that hundreds of households have been left displaced, with reports of fatalities and even a missing child. Let's speak about this. How are search and rescue operations unfolding under these dangerous conditions?
I think we are very fortunate at the South African Red Cross Society, because we work closely with the likes of the K9 search and rescue teams. So although we are not mandated to do the search and rescue ourselves, but we are supported, and we do have MOUs with such entities so that we can also support as best as we can in these current times. We are also wishing them all of the best in their search and rescue efforts, because you can imagine that when a child goes missing, when an elderly person goes missing, it just pulls on your heartstrings. So a lot of effort is being done on the ground, and a lot of support from the South African Red Cross Society is also being extended to such entities.
From what we're gathering, you've also activated the National Response Team along with provincial and local branches. What immediate support is the Red Cross then providing to the affected families, especially vulnerable groups like we mentioned older persons, children, and even people living with disabilities?
Yes, so the National Response Team has been activated because the impact was that severe and it was exceeding the local capacity. So in the form of support, we are giving, as I said, socio-psycho support to the affected families. We are doing rapid needs assessments also to make sure that when we come back into the communities, our support is targeted, our relief is very context relevant. So whether it's in the form of blankets, whether it's in the form of mattresses, in areas such as Mthatha, which was a previous disaster, we gave out solar kits which meant that families that have been disconnected from electricity services, they're able to use these solar kits to connect their phones. They also have lighting services using these solar kits. So we're doing those rapid assessments to make sure that the relief we provide will benefit the affected families, and it was with dignity. So it's a dignified response.
As we get a better sense of the situation on the ground, Dimpho, we do understand as well that many communities are completely cut off, with roads inaccessible and emergency services struggling to reach them. How's the South African Red Cross Society then coordinating with municipalities? We mentioned the SAPS as well, but also the SANDF to overcome some of these challenges.
Coordination has never been more important than it is now, and disasters expose when there has been a lack of groundwork where coordination is involved. So luckily, when there are peace times or quiet times, we are working very closely with the likes of the South African Weather Service, like I said, the National Disaster Management Center, but also at a provincial, at a branch level, those structures are also in place, making sure that we're working closely with SAPS, not just for efforts, but for referral pathways. Sometimes in such events, in evacuation centers, there will be certain cases that you need to refer to SAPS. So in those efforts and in those coordinations, we're able to exercise our sort of relationship with those organizations and make sure that referral pathways, job meetings, we're also very active in, that our coordination is very strengthened and there are no gaps or double dipping in our response or our efforts.
Dimpho, safe to say that psychosocial support is also a critical part of disaster response. What kind of trauma are communities experiencing there, and how is the Red Cross then helping people cope really during this crisis?
I don't even know where to start in speaking about trauma, because I think a lot of the time when we think of relief or response in these disaster events, we're thinking of tangible things like your blankets, your mattresses, your food parcels. But the trauma is, the scale is different, that I can say, because you have people with pre-existing vulnerabilities that have now been struck by not just one disaster, because as we've seen, disasters are not just sporadic, isolated events, they are reoccurring. So when you combine this with your pre-existing vulnerabilities, the scale of the trauma is very deep, and it needs people who have a love and care for this kind of space. It also needs people who are capacitated in this space, and we're very privileged at the Red Cross Society to have people who are capacitated in this regard. We also rely on a backbone of volunteers. We have volunteers in these communities. So when the volunteers based in the community, already there's the language barrier that's eliminated, and they have certain contextual realities that they understand within their own communities. So when they are capacitated even further to give out psychosocial support, you can understand that it's coming from a place of a deep understanding of the trauma, of the pre-existing vulnerabilities, and also cognizant of the fact that the disaster will likely happen again. So there's also preparedness initiatives, there's early warning sensitizations that are also being disseminated and prioritized when these type of services are being rolled out.
Yeah. Dimpho, in areas like Giyani as well as Tanin, schools have been suspended and shelters have also been set up there. What conditions are displaced families facing in these temporary shelters?
As temporary shelters perhaps serve the purpose of getting that family or that person out of the immediate risk, you'll find that certain services are being overwhelmed, such as ablutions. There's limited toilets, there's limited space, there's limited privacy. And when we're saying that we want to prioritize vulnerable groups, what makes them vulnerable. If someone is in an evacuation center and they are a woman and they are perhaps a younger woman and they are from a certain socioeconomic background and so forth. Perhaps they're living with a disability, and all these compounded vulnerabilities and intersecting identities of a person need to be acknowledged. So the immediate risk of getting the person perhaps out of a floodplain area might have been addressed, but we also need to be sensitive that evacuation centers do not cater to secondary sort of realities that a person might be coming in with.
Yeah. Dimpho, you mentioned immediate risk. With more heavy rainfall forecast, what are the biggest risks in the coming days, and how prepared are response teams from what you see if the situation does worsen?
The situation is likely to worsen based on, the advisories that we have received, both from the South African Weather Service and also from our international movement partners. So we are cognizant of the fact that we need to still prepare for the worst. And this type of preparedness that we are initiating or have already started initiating at the South African Red Cross Society is early warning disseminations. These go a long way in Nhlanhla because you'll disseminate in high-risk areas, in local languages, and in actionable points for communities to take the early warnings into early actions. We're also emphasizing and pleading with the public at large, as well as corporates, to join forces with humanitarian organizations, especially with the South African Red Cross Society, because we cannot address the need and the scale alone. It's a really huge responsibility. Unfortunately, we're not able to help everyone as much as we would like to. We have to prioritize. But in this, we're saying that we know that the reality of climate change is amongst us. It has materialized in even previous disaster events. So we are pleading with corporates, with the public at large, to visit our website at www.redcross.org.za. And to partner with us to make the South African Red Cross Society the humanitarian partner of choice, knowing that we are at the community level, and that is where the impact is greatly felt.
Yeah, let's add to that a bit more. What safety advice is the Red Cross giving to communities who may feel even forced to cross rivers or travel flooded roads to access food, healthcare, or other essentials?
Well, firstly, if travel is unavoidable, we would advise that at least it should be done in a way that will still prioritize the life of that person. And by that, I mean there's safety in numbers. So if you absolutely have to travel, do not do it alone. Avoid low-lying bridges. Avoid areas where you can see that it has probably flooded and there's still residue left on the roads. Familiarize yourself with evacuation centers. A lot of people in communities, you'll find that they don't know where the closest evacuation center is. So familiarize yourself with evacuation centers. Keep an emergency kit bag with all of your belongings. So in the event where you are forced to evacuate, you have all of your belongings in one place and you can just take them and go. Keep a lookout for children, keep them close by, keep them safe, keep yourselves safe, avoid flood waters, don't underestimate flood waters. Sometimes people think that they're shallow and they can take a chance, only for the worst to happen. So we do not want that to happen and to be the case for our families and our communities. So those are just some of the tips. When you do see Red Cross volunteers, as I said, they are in these communities and they are disseminating. Take those early warnings with a sense of urgency, knowing that these volunteers have been triggered because there has been a forecast.
And finally, Dimpho, how can members of the public then support relief efforts? And what message can we still give to our audience or send to affected communities who may be feeling trapped or even overwhelmed right now?
I do encourage for members of our communities and our society to again visit the Red Cross website at www.redcross.org.za. There is a lot of services that we do. Unfortunately, we are restricted by time for me to go through all of them. But visiting the website, not only is there a donation tab, but there are several types of trainings available for people to be able to capacitate themselves and also be their own first responders in these type of disasters. There are provincial offices. The South African Red Cross Society has a footprint in all 9 provinces, in 52 branches as well. So make use of those services, make use of our psychosocial support services, make use of our landline, which is also available on the websites, and partner with the South African Red Cross Society, partner with the local community structures, the awareness watches, the community groups. This will also assist greatly in the work of preparedness in this disaster space.
As rescue teams race against time and communities remain cut off by rising flood waters, the scale of this disaster is still unfolding with red level 10 warnings in place and more rain expected. Authorities are also continuing to urge residents to prioritize safety and avoided flood areas like we just heard. Thanks to our guest there, Dimpho Teffo. She's a disaster officer at the South African Red Cross Society, giving us a sense of the lay of the land and just the impact of this disaster.